So I'm in a very large tertiary care academic hospital out on the tip of Long Island, basically. And we have numerous learners that come through our program, our palliative care program. I have a large team, I've had new staff, and also we interface with so many programs around the hospital pretty much all day long. So I've been using the CAPC curriculum in a number of ways. The use of the curriculum really as an onboarding tool for my own staff and to sort of demonstrate competencies of my own staff. For instance, we had our advanced certification in palliative care recertification this past May, and I essentially told everybody that they need to do the entire CAPC curriculum. And that included 14 pain courses, which I really love the way the pain courses are set up because they get harder as you go along, and you can also tailor them to different learners. So they did all the CAPC pain courses and the 4 Vital Talk communication courses and what is palliative care in preparation for our recertification for Joint Commission. And it was fabulous because we were able to put the certificates for the courses in their employee folders, and the Joint Commission people went through the folders and saw all the CAPC certificates, and we just looked golden. We could see the big smiles on their face, and they're like, I see, you've really worked to onboard your staff, and it was so easy, really. I think it's helped my staff feel more confident about what they're doing, and also has given them a basis to be teachers for the people that come through our program. So that's the first place I started. I required that anybody who works on our team take all the courses. And then there's also CEUs associated with them, so they were able to get credit for those courses as well. So that added a little extra bonus to taking them. The other way that I've been using them is really with any learner that comes onto our service. We've developed a very specific syllabus for them to do CAPC courses. For instance, we have oncology fellows, geriatric fellows, medical residents, medical students. I actually have pharmacy residents, emergency department residents, and what we've done is we've tailored the syllabus of CAPC courses to that particular learner level. So if I have a medical student, I might have them do communication courses 1 and pain courses 1 through 7. If I have an oncology fellow who's going to be on service more, I've been having them do pain courses 1 through 14 and all the communication courses. PharmD resident, we've been tailoring the courses to things that they might find very interesting, doing pain assessment, substance use disorder course, dosing. Essentially, I had them do all the courses as well. I've been finding the courses are really flexible for the learners that I have coming through my program. And I find that program directors are very happy to accommodate making sure they do the courses as well. So for instance, we have medicine residents coming through, and the program director did the courses and loved them, and she wanted all the medicine residents to do the courses. So when they come through our program, they do the courses 1 through 7 of pain and communication, and then we have them do 7 through 14 on an outpatient palliative care experience that they do in the 2nd year. So that's really been a wonderful way to utilize the courses. The other way that we've been using them is as a way to help people we work with understand what we do. For instance, we are embedded in the LVAD team at our hospital. And we sat with the director of the LVAD program and we picked out a few courses for them to do because he didn't feel that they would have the time, for instance, to do all the courses. And so we picked out some, and they did courses that helped them with their advanced certification for Joint Commission also, because they demonstrated that they were actually getting education in palliative care for their certification. And also it allowed us to sort of help them understand some of the issues around palliative care. We had them do, for instance, the What is Palliative Care course, some of the pain assessment courses, and then they really liked also the communication courses, which are truly wonderful. In group settings, for instance, we've had we've had learners log in a learning center on computers in a group, like 20 people, and then I've taught the one of the communication courses with a group. And it's a fabulous way to teach communication because you have the foundation of the course, but then you can spin off of it and make it very interactive. So we've been using the courses that way as well. The chaplains actually were very interested in doing the communication courses, and the entire chaplaincy service did all 4 of the Vital Talk communication courses and received CAPC designation. I think they're the first in the nation to have received a CAPC designation for doing all of the courses. And they felt very proud. We actually highlighted that for our Joint Commission survey, put their picture up. We took a picture of them and highlighted that when the Joint Commission came through. And then after that, actually, what we did with them is after they did all the courses, we had an interdisciplinary learning conference with them and talked about communication, and they were also giving us, teaching us about communication. So it was a very good interdisciplinary trigger to have education with our chaplains.